The most appropriate nursing action for a patient who developed dyspnea and shortness of breath would be: Option A. Maintain the patient on strict bed rest at all time. Option B. Maintain the patient in orthopedic position as needed. Option C. Administer oxygen by venturi mask at 24% as needed. Option D. Allow 1 hour rest period between activities. The answer is option B. Maintain the patient in a orthopedic position as needed. When a patient develops dyspnea and shortness of breath, the orthopedic position encourages maximum chest expansion and keep the abdominal organs from pressing against the diaphragm, thus improving ventilation. Bed rest and oxygen by venturi mask at 24% would be improve oxygen of tissue and cells, but must be ordered by a physician. Allowing to rest period decreases the possibility of hypoxia. When a patient in the terminal stage of lung cancer begins to exhibit loss of consciousness, a major nursing priority is to: Option A. Protect the patient from injury. Option B. Insert an airway. Option C. Elevate the head of the bed. Option D. Withdraw all pain medication. The answer is option A. Protect the patient from injury. Ensuring the patient's safety is the most essential action at this time. The other nursing action may be necessary but are not a major priority. The physician ordered a maintenance dose of 5,000 units of subcutaneous heparin daily. Nursing responsibilities for these patients include: Option A. Reviewing daily APTT and PT. Option B. Reporting an APTT above 45 seconds to the physician. Option C. Assessing the patient for signs and symptoms of frank and occult bleeding. Option D. All of the above. The answer is option D. All of the above. All of the identified nursing responsibilities are pertinent when a patient is receiving heparin. The normal APTT is 16 to 25 seconds and a normal PT is 12 to 15 seconds. All patients receiving anticoagulant therapy must be observed for signs and symptoms of frank and occult bleeding, including hemorrhage, hypotension, tachycardia, tachypnea, restlessness, pallor, cold and clammy skin, thirst and confusion. Blood pressure should be measured every 4 hours and the patient should be instructed to report promptly any bleeding that occur with toothbrushing, bowel movements, urination or heavy prolonged menstruation. The four main concepts common to nursing that appear in each of current conceptual models are: Option A. Person, nursing, environment, medicine. Option B. Person, health, nursing, support systems. Option C. Person, health, psychology, nursing. Option D. Person, environment, health, nursing. The answer is option D. Person, environment, health, nursing. The focus concept that have been accepted by all theorists as the focus of nursing practice from the time of Florence Nightingale include the person receiving nursing care, his environment, his health on health illness continuum and nursing action necessary to meet his needs. The family of an accident victim who has been declared brain death seems amenable for organ donation. What should the nurse do? Option A. Discourage them from making a decision until their grief has eased. Option B. Listen to their concerns and answer their questions honestly. Option C. Encourage them to sign the consent from right way. Option D. Tell them body will not be available for wake or funeral. The answer is option B. Listen to their concerns and answer their questions honestly. Brain death patient family needs supports and reassurance in making a decision about organ donation because transplants are done within hours of death. Decision about organ donation must be made as soon as possible. However, the family's concern must be addressed before members are asked to sign a consent form. If nurse administers an injection to a patient who refuses that injection, she has committed. Option A, assault and battery. Option B, negligence. Option C, malpractice. Option D, none of the above. The answer is option A, assault and battery. Assault is unjustifiable attempt or threat to touch or injure another person. Battery is the unlawful touching of another person or carrying out of threatened physical harm. Thus, any act that a nurse performs on the patient against his will is considered assault and battery. Patient asks the nurse her opinion about particular physicians and the nurse replies that the physician is incompetent. The nurse could be held liable for option A, slander. Option B, libel. Option C, assault. Option D, respondent superior. The answer is option A, slander. Oral communication that injures a individual's reputation is considered slander. Written communication that does the same is considered libel. A nurse reaches to answer the telephone on a busy pediatric unit, momentarily turning away from a 3-month-old infant she has been weighing. The infant falls off the scale, suffering a skull fracture. The nurse could charge her with option A, defamation. Option B, assault. Option C, battery. Option D, malpractice. The answer is option D, malpractice. Malpractice is defined as injuries or unprofessional actions that harm another. It involves professional misconduct such as omission or commission of an act that a reasonable and a prudent nurse would or would not do. In this example, the standard of care was breached. A 3-month-old infant should never be left unattended on a scale. All of the following can cause tachycardia except option A, fever. Option B, exercise. Option C, sympathetic nerve system stimulation. Option D, parasympathetic nerve system stimulation. The answer is option D, parasympathetic nerve system stimulation. Parasympathetic nerve system stimulation of heart decreases the heart rate as well as the force of contraction, rate of impulse contraction, and blood flow through the coronary vessel. Fever, exercise, and sympathetic stimulation increases the heart rate.